Let's talk now about anatomical terminology. Now, anatomical terminology is what we're going to be using to describe the front, the back, the side, the inside and away. So there's no more before, there's no more behind, it's all anterior, posterior. Now if you can remember that when we spoke about the axial and the appendicular skeleton, the anterior was the front of the skeleton or in front of the midline. So when you're talking about the body, you're always in describing it as in from an anatomical position. So anatomical position is when you're standing forward facing with your palms or your hands facing forward as well. So everything that we're referring to right now is from an anatomical position. So the anterior is in front of the midline. The midline is an imaginary plumb line that runs down the centre of the body, and that's what we use to separate different parts of the body. The anterior is towards the front, the posterior is behind the midline. Now looking at the lateral, remember that we spoke about the lateral aspect when we spoke about the curves of the spine. Lateral would mean to bring something away from the midline, and then medial is towards the midline. So lateral, medial. Superior is the upper aspect of a structure or the upper part of your skeleton. Your mandible or your jawbone is superior to your sternum. Inferior describes something that is below or underneath. So inferior in regard to your patella would be inferior to your pelvis. So I'll just bring Henry up and you can see that the patella is inferior to the pelvis. Sub refers to below. So sub as in subscapular just means below the scapula.